Hello, everyone, and welcome to Eyes Gotta Have It, our webinar focused completely on the eye area. We will be going over both surgical and non-surgical. Dr. Chaboki will be presenting, and then we'll have an open Q&A session. So if you have questions along the way, please don't hesitate to send me or Lauren a quick chat with your message and your question, and we'll be sure to get those out for you. Sit back and enjoy, and Dr. Chaboki, take it away.
Great. Thank you, Janet. Thank you, everyone, for joining. We've had several who wanted to come, but they couldn't because of work. So we're going to record this video presentation, and let me share my screen here. Okay. And we'll do all the questions at the end. For those who know me, I do facial plastic surgery here in Washington, D.C. We have a great team, and we've had these webinars for the past several months. And today we're going to focus on eyes. Please no photographs or video. Standard disclosure, I have no financial relationships with any company. A lot of what we do is off-label. And this is really just educational and opinion only. I always introduce myself to new patients. You know, I grew up in the Chicago area, went to undergraduate at Northwestern and medical school at University of Illinois, and then went to New York for training in head and neck surgery and facial plastic surgery. And then we moved here about 14, 15 years ago, and I've been practicing in downtown Washington, D.C., just walking distance from the White House for a while now. And this is our current team. You'll meet them or speak with them if you haven't already. And while I focus on the entire face, today's presentation, we're going to look just at the eyes, the upper eyes, the brow, and lower eyelids, both surgical and non-surgical. And patients often report concerns of appearing tired when they're not, or appearing low energy when they're not, eye bags, dark circles, droopy skin. And these concerns can occur at a very young age, middle age, or older age, really at any time in your life. And as a facial plastic surgeon, I look at two things primarily, but anatomy is fundamental. Is there a laxity issue with the skin and muscle? Is there a structural issue with the bone and fat? Or more commonly, some combination of the two. And for the upper eyes, is primarily a laxity issue. The eyebrow falls naturally as we get older. Excess skin develops in the upper eyes, and patients may have hooding or difficulty applying makeup, or just appear to have smaller eyes because of that descent of tissue. But there's also a natural structural change as occurs with fat and bone. With fat, we have fat loss under the eyes, in the cheeks and the temples, shown in the shaded blue. And on the right, we do have some fat gain in the eyes. That contributes to the bulge. But we also have bone loss around the eyes. The eye socket becomes larger, the cheekbones become flatter, and that contributes to the way we look as we get older. First, we'll review some non-surgical treatments here we have in the office, and then we'll review some surgical, and we'll show you examples, really. And a chemical peel, the peel we do in the office is not the same that we do at a spa. This is really more of a medium depth peel. It's the deeper we go, the more profound the results. And it's really more for the superficial wrinkles, improves texture and tightening of the skin. And here is an example. This patient had a full face peel, but if you look at her lower eyes, she has less wrinkles. What are relaxers? These are the next line of non-surgical treatments. We call them relaxers because they relax muscle that contribute to wrinkles around the eyes. There are different brands that you may well know, such as Botox, Dysport, Xeomin, Jeuveau, and there are more coming down the line. They commonly relax the wrinkles on the sides of the eyes, in between the eyes or forehead, but they also can create a non-surgical brow lift. Here's an example of a patient. Her skin is smoother around the eyes, but her eyebrow is also elevated. She has less skin in her upper eyes. And this is all without surgery. Now, relaxers are temporary. Patients are coming in every few months for these injections, and they've been very happy. Another class of non-surgical options to rejuvenate the eyes include fillers. And the fillers are made out of hyaluronic acid, normal material found in our skin, and also there are different brands which you may be familiar, such as Juvederm, Restylane, Belotero, RHA, Versa. There's a whole array of options, and more are becoming available. Fillers we do primarily for focused rejuvenation, such as under the eyes, the upper cheeks. They may be used alone, but also commonly treated with relaxers. Now, fillers, the way we approach fillers for the natural results, we don't inject to full correction right away. We build up over time, and then at that point, we are in a maintenance phase. And patients come in once in the maintenance phase, maybe once a year or twice a year for touch-up and enhancement. What are the advantages of fillers? There's no long-term commitment, similar to relaxers. You can test drive, give it an idea of what you may like before committing to any kind of surgery. These may be dissolved. It's less invasive. It's a kind of a lunchtime lift or a liquid lift, as some refer to. And we give fillers commonly in these areas around the eyes. Under the bag, where the dark circles are, the upper cheek, to camouflage a bag and make one appear more rested, like you had a good night's sleep. And here are some examples. This is a patient, young, also complains of dark circles and eye bags, and she just wants to look fresher. And we did fillers. A few injections of fillers over time to achieve natural results. Here's another patient, same thing, with fillers over time to create natural results, primarily of the lower eyelid area and upper cheeks. Here's another example. And these results are not always developed right away with one office visit. For the best results, we want to go gradually, conservatively over time. Well, what about fat? We do a lot of fat transfer. And some patients prefer fat because it's natural. It's your own fat. There's nothing synthetic. When we do fat, however, we're doing more of a global rejuvenation. And what do we mean by that? We're doing the eyes, we're doing the cheeks, we're doing the lips, we're doing the smile lines, we're doing multiple areas at once. And often when I do fat injection, it's combined with a facelift or neck lift or something else. And fat in the face is different than when plastic surgeons do fat transfer in the breast or fat transfer in the buttocks. We're doing microfat or nanofat, really small fat to create a smooth result in the cheeks and the eyes. What are the advantages of fat? It's natural. It's a potential for longer lasting. Fillers, patients have to come in periodically. Fat patients, most patients after fat transfer don't have to come in as often. And we're treating multiple areas at once. And there's some evidence to support that there's a stem cell benefit in the fat that's not quite well understood, that's being investigated. So here's an example of a fat transfer patient. She's had fillers before, as many patients had. She had fillers, but she wasn't ready for more fillers. She wanted something longer term, natural, so we did fat transfer. But we did in multiple areas: lower eyelids, upper cheeks, smile lines, lip, to create a global rejuvenation for her. Well, what about surgery? The eyes, for patients who are considering cosmetic surgery, the upper eyes are usually the first step in many patients. And we remove excess skin. Upper eyelid surgery alone can be done in the office, local anesthesia. Patients are awake, we just remove a conservative amount of skin or fat as appropriate. And here's a marking right before surgery. And here an example of a result. In the before on the left of the screen, patient has full upper eye area due to excess skin. And on the right of the screen, now we see her eyelid more visible. She could apply makeup more easily. And patients, consider, are worried about scarring after any kind of plastic surgery, but especially eyelid surgery. Usually is not a concern in our office. This is the patient with her eyes closed. And if you look closely, yes, you'll see a scar in any kind of plastic surgery, but generally doesn't draw attention, even when the eye is closed. Lower eyelid surgery treats primarily the fat of the eye, the bulge. And this is an example of a patient who had lower blepharoplasty to reduce the eye fat that naturally increases with age. There are two ways to do lower eyelid surgery. One, you can make an incision on the outside. The other is you can make an incision on the inside. I usually perform a surgery on the inside to avoid any external scar. We tailor the procedure to the specific needs of each patient, but this particular patient had an inside approach for his lower eyelid surgery to create a smoother transition between the lower eyelid and cheek. What about the brow? So I do a brow lift, and it's a very conservative procedure. Here in the white, those are the typical incisions, what we call a limited incision brow lift. And the brow lift doesn't create an unnatural arch to the eyebrow. That's not what we do. We're really trying to fundamentally create a more open eye. Not every patient would benefit from brow lift, and during the office evaluation, we'll guide you if you're a candidate for a brow lift. We don't shave the hair. There's really not a lot of pain. It just feels a little tight initially. And patients have been very happy with a brow lift. This is an example of a patient. All she had between the before on the left and the after on the right is a brow lift. Her eyes are more open. The eyebrow doesn't appear unnaturally elevated. She appears herself just a more rested version of herself. Well, what about combined procedures? Again, at the end of the day, it goes back to the specific anatomy of a patient, what their goals are, what their downtime is. A lot of factors go in their health, what other procedures they've had done, how much of a change they want to see. And, we have a conversation in the office, during we do examination and everything. And when we combine procedures, it can be a non-surgical with a surgical, it could be a filler with a relaxer, upper eyelid surgery with lower eyelid filler, chemical peel with brow lift. We can mix and match against the needs of each patient. Here's a patient, she had a brow lift and upper eyelid surgery. And again, her eyes appear more open. She appears more rested. She looks herself, just a better version of herself. And that's what we're trying to achieve. Here's a patient who had multiple procedures done. She had a brow lift, upper eyelid surgery, lower eyelid surgery, and fat transfer. And the lower eyelid surgery was done with the inside approach, so to avoid any external scar. Here's another example of a combination procedures. This patient had upper eyelid surgery with a conservative amount of fat and skin reduced. She had lower eyelid fat transfer and fat transfer to the upper cheek, but also fat transfer to the smile lines. And she had a chemical peel, the entire face, not just the lower eyelids in this case, but the entire face to create a more refreshed appearance and rejuvenated appearance. We want people to look themselves, just a better version of themselves. So what's the best? As I always say, there is no one best. There's no one best filler or relaxer, one best procedure. And that's why we like doing plastic surgery, because it's very unique for each individual. Thank you. And Janet, I'll throw it back to you for Q&A, and I'll take off the screen share.
Okay. Can you see me?
Yep.
All right, a couple questions for you, Dr. Chaboki.
Yes.
So after a chemical peel on the eye area, was that before and after? Was that only a peel done? She didn't have any filler? She didn't have anything else under the eye? That was just
well, good question. Most patients in their past have had other things, such as fillers, relaxer injections, Botox, surgery, or whatnot. But that particular before and after is peel. And we always talk to patients, even with peel, patients may still want relaxer injections. Even with relaxer injections, they may want filler. Or even with surgery, they may need something else down the road. we're capturing you in a moment of time to enhance your appearance naturally with minimal downtime as much as possible.
When it comes to the Botox brow lift that we saw,
Yeah.
do you always get that brow lift? Is that something we can always expect when we do our Botox?
No, that's a good question. You know, a non-surgical brow lift. So we ask a patient, would you like smoother wrinkles? Would you like to elevate your eyebrow? Many patients, they want to keep their brow where it is. They just want smoother skin. So we modify the Botox or what we call relaxers, again, to the needs of each patient. But in that example that I showed, she wanted higher eyebrows. She knew she needed upper eyelid surgery. She knew she needed brow lift surgery, but she wasn't quite ready at that moment in time for surgery. So we did non-surgical methods to achieve a temporary conservative improvement in her appearance with low downtime. Janet, I think your video cut off. Well, for those of you, can you hear me now?
I can hear you now.
Yeah, you froze for a second. You had another question?
I do.
Yeah.
Are chemical peels safe around the eye area? Isn't the skin really thin around the eye area?
Yes. That's a good question and a valid concern. So we do a medium depth peel. It's deeper than a standard peel that you may get once a month at other offices. This peel that we do is maybe once a year. You know, it's not that often. There is a longer downtime with this peel. And yes, we do go around the eye, but very conservatively. And the way the peel works is it's a controlled removal of the top layers of skin to allow the body to replenish and create a new coat of skin. But patients have been very happy with the peel that we've done. There is some downtime. Again, we talked about it, and they have to put Vaseline or some kind of ointment on their skin to maximize healing afterward.
Do you
But
treat
they
this? Do you
Go
treat
ahead.
the skin in the eye area
Yep.
differently with the peel versus?
Well, we're very careful and cautious, but yes, we go underneath the eye, right here, or on the side of the eye, the forehead, and you know, some patients will have eyelid surgery, but they need a little bit more tightening. They don't have too much skin to remove, just a little bit of tightening, so we'll do a peel under your eye, and it takes a few minutes in the office.
So I'm going to go back to under eye filler. When you have the difference between bulging eye, under eye versus a hollow eye
Yeah,
versus dark circles,
yeah.
are all of those covered and able to be concealed with a filler?
To a certain degree, yes. So with a dark circle, that is various reasons why someone will have a dark circle. It could be pigment issue, it could be blood vessel issue, it could be a hollowness issue. They can be improved with fillers by filling the hollow and expanding the skin, stretching the skin to a certain degree to make it appear less dark and bringing it out into the light. Patients with bags, we're using fillers to camouflage the bag. They have the bulge or the bag or excess fat higher up, and below the bag, we're injecting a conservative amount of filler to camouflage it, so the bag doesn't look as big. Again, we are treating how the face changes. We lose fat underneath the eye and upper cheek. We gain fat in the eye. And either with adding fat or filler or removing fat, we're tweaking specific areas by reducing volume, adding volume to really draw attention more to the whites of the eye instead of anything around the eye per se.
So we never gain fat where we want it.
Correct. Yeah, correct. Yeah, correct.
So how long does fat transfer last?
Well, theoretically, it can last forever. But you know, a percentage of patients where we do fat transfer, that fat goes away. We take fat from your abdomen or thighs and very carefully take it out with liposuction, a very gentle process. And these are small micro fat particles that we inject to create smooth results. That being said, keep in mind your face is also changing over time. You're still losing fat. You're still losing bone. The eye socket is still widening over time. That being said, most patients after fat transfer may not need or want additional volume treatment for at least 6 months, if not a year or more afterward. And if they do need fillers or additional volume, it's generally not as much as they would have needed if they never had fat transfer.
Can you see after eye surgery, or is there like a time period where you're not going to be able to see your phone or see your computer? Or
No, you should be able to see. Yeah, no, absolutely, you should be able to see. What we ask you not to do, we ask you not to drive for the first day. We ask you not to, spend an extended amount of time in front of a computer. But no, you should see. You should be able to walk. You should be able to do, light activities around the home. That you should do. And most patients after eyelid surgery or brow lift surgery, it's not pain. It just feels a little tight. It feels a little heavy. And we have them do certain exercises to reduce swelling. The eyes tend to swell and puff up a little bit, but your eyes are open, you should see. And if there's any issues, patients have my cell phone so they could call me right away after surgery if there's any concerns.
so, would you consider running an activity I could do after eye surgery?
Running, I would avoid, or any kind of exercise, I would avoid. At
For
least
how
the
long?
first week, maybe 2 weeks afterward. And that's primarily anytime your heart rate is up or your blood pressure spikes up, you could open up blood vessels and bruise and swell. So we want to minimize that for the first several days after eyelid surgery or really any kind of surgery.
When can you go back to work? When can I go back on Zoom after I've had eye surgery?
Yeah, well, Zoom is something particular in this pandemic, but because it's on the screen. But going out in public, in terms of bruising and swelling, I advise patients wait at least 1 week, maybe two. Everyone's different, but a majority of patients feel comfortable enough going out in public after 2 weeks. Now, it's a case-by-case basis. Some patients need a little bit longer. Some patients need a little bit shorter. And then the other thing is, you can wear makeup after a period of time to camouflage any bruising if it occurs. And we guide patients as when they can do that.
Do you have to get upper eyelid surgery over and over in your life if you do it young, or is this kind of a one and done surgery?
Well, we don't do it too often. So in upper eyelid surgery, patients consider another eyelid surgery on the upper eyes, maybe 5 to 10 years, because it takes a period of time for an additional skin to develop in that area. But some patients are born with excess skin. So even in patients I've seen, we do surgery in their 20s to remove excess skin because they were born with very heavy eyes. They generally don't need another surgery for several years. Most patients are starting to consider upper eyelid surgery anywhere in their upper 30s, 40s time frame, and that incidence increases with age.
If I have hooding on the eyes and I need to get rid of excess skin on the upper eyelid,
Yeah.
how visible is the scar, and where would that scar be if you have monolids?
Yeah, good question. For those with monolids, we have a conversation. Do you want a double eyelid? Do you want a crease? And then those are patients who have a ethnic background of Asian descent of some capacity. But scars generally haven't been an issue, even with their eyes closed. Now, when your eyes are open, generally you don't see the scars. Scars fade with time. For patients who have a predisposition for scars, there's some treatments we can do with injections to shrink a scar or to make a scar softer. but upper eyelid scars really have not been an issue that we've seen so far.
Great. How do you combine, what surgeries combine well together? I mean, would you just do the eye area, or is there other surgeries that you can do along with the eye area if you're looking at multiple corrections?
Yeah, it's really case by case basis. You know, everyone's anatomy is unique. Everyone's changes over time are unique. Even twins, they may age a little differently. And again, how much downtime you have. So most commonly, patients come in, we'll do upper eyelid surgery that could be done in local anesthesia, it's a quick procedure. And they need a brow lift. So upper eyelid surgery and brow lift are commonly performed together at the same time. Lower eyelid surgery and fat transfer are usually done at the same time. But then again, let's go back with the concern. Patient may have a concern of their chin or neck and their eyes, or the nose and the eyes. And, you know, we mix and match to the needs of each patient in a safe and natural manner.
How long is the typical eye surgery? Like if we did under eye with fat transfer, how long does that take in
That
surgery?
usually takes maybe an hour, hour and a half. We block out time in the facility, about an hour, hour and a half.
Great. Does anyone have any other questions that we should send out to Dr. Chaboki now? Now's the time. Well, I want to thank all of you for joining us today, and thank you, Dr. Chaboki, for your words of wisdom on getting the eye area taken care of.
Great, thank you. Yeah, thank you everyone for joining us. And we record all these sessions so they're available for review at any point on online. All right, take care.
I have one more question for you.
Sure, yeah, go ahead.
For fat transfer and the temporal area, which is the side there, do you see a secondary upper eye rejuvenation effect when that happens?
Yeah, you know, there's the thought where we all lose fat, and this in the temples, there's an area that we tend to lose fat in. So injecting fat or injecting filler off label can help rejuvenate that area, so you're less quote unquote skeletonized. And when you inject fat here, you may see a little bit of brow elevation, not the same as a brow lift, but it can rejuvenate the upper eye to a certain extent. The main reason to fill the temples is to look less skeletonized and to look just fresher.
All right, thank you so much. I do want to let everyone know that this month is our month for eyes, and please check your newsletter because we have some great offers in there.
All right. Take care, everyone. Stay safe. Bye-bye.
You're welcome. Bye-bye.